Most people over 65 are being told their blood pressure is fine, and then they have a stroke. The number your doctor told you to aim for, 120 over 80, was designed for someone 30 years younger. After 65, that same target can quietly starve your brain of blood, collapse your kidneys, and send you to the emergency room in the middle of the night. And here is what nobody tells you. Trying to get your pressure too low might be just as dangerous as letting it run too high. Stay with me until the end, because the number one thing I am going to reveal today completely changed how I treat my older patients. A landmark study found that for adults over 70, the ideal systolic pressure is not what your chart says. It is a specific range, and if you are outside it, your risk of heart failure, cognitive decline, and early death jumps by more than 40%. Almost no cardiologist talks about this in a way that patients can actually understand. I am going to change that right now. I am Dr. Thomas Ashford, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60 who were doing everything right and still ended up in trouble because nobody told them the truth about blood pressure after 65. The guidelines you have been following were not written with your body in mind. What I'm about to share goes against what most general practitioners still tell their patients today. But I have seen it with my own eyes, and I refuse to stay silent any longer. If this information already seems valuable to you, hit that like button right now. It helps more people over 60 find this channel and get the real answers they deserve. Here is what is happening inside your body right now if you are over 65. Your arteries are not the same arteries you had at 40. After decades of pumping blood, the vessel walls naturally become stiffer. This is called arteriosclerosis, and it is not a disease. It is biology. The problem is that stiff arteries require more pressure to move blood effectively. Your heart has to push harder to get oxygen to your brain and your organs. So when a doctor puts you on medication to bring your number down to 120 over 80, they may actually be cutting off blood flow to the places that need it most. A 2021 study published in the Journal of the American Medical Association found that in adults over 70, systolic blood pressure below 130 was associated with a 34% higher risk of kidney decline compared to those in the 130 to 145 range. Another analysis in the New England Journal of Medicine found that older adults who aggressively lowered their pressure to match younger patient targets had significantly higher rates of dizziness, falls, and acute kidney injury. And here is what terrifies me most. Falls are the number one cause of injury-related death in adults over 65. Low blood pressure causes dizziness. Dizziness causes falls, and many of those falls happen because a well-meaning physician lowered a patient's blood pressure too aggressively. This is not a fringe opinion. The American College of Cardiology quietly updated its senior guidelines to reflect a more conservative approach. But those updates are not always reaching the patients who need them most. This is not just about a number on a cuff. When blood pressure is mismanaged in older adults, everything falls apart. Energy drops, memory fogs, kidneys strain, balance fails. And the tragedy is that most people accept this as normal aging when in fact it is a correctable and preventable problem. Before we go further, let me ask you something. When was the last time your doctor explained to you what your blood pressure numbers actually mean for your age? If the answer is never or not recently, type never in the comments below. I read every single one, and your answers help me know exactly what to cover next. Now, I want to walk you through the most important things every person over 65 needs to understand about blood pressure. I have organized this from the most commonly misunderstood points to the single most important truth that almost no one knows. By the time we get to number 1, you will have a completely different understanding of how to protect yourself. Starting with number 7, the 120 over 80 myth. This is the target printed on posters in every waiting room in America. It has been drilled into patients for decades, and for a 40-year-old, it is a perfectly reasonable goal. But after 65, reaching that number can require aggressive medication doses that put the body under enormous stress. The blood pressure guidelines that most primary care doctors use were developed from studies that underrepresented adults over 70. In fact, many of the landmark blood pressure trials excluded patients over 75 entirely. So the number your doctor is targeting may not have a single day of evidence supporting its use in your body specifically. What the research tells us is that the optimal systolic range for most adults between 65 and 79 is closer to 130 to 145. Not below 120. Not necessarily below 130. A range. A zone that keeps blood flowing to a brain that needs more pressure to receive it, not less. Here is something most people miss. Blood pressure is not a static number. It rises when you stand up, when you are cold, when you are stressed. In older adults, the gap between lying down pressure and standing pressure can be enormous. This is called orthostatic hypotension, and it is one of the most underdiagnosed conditions in seniors. If your at-rest pressure is being pushed to 115, what happens when you stand up quickly in the middle of the night? Your pressure might drop to 90. That is when you fall. That is when you fracture a hip. That is when everything changes. Moving on to number 6. The danger of treating both numbers the same way. Your blood pressure reading has two numbers. The systolic on top measures the pressure when your heart beats. The diastolic on the bottom measures the pressure when your heart rests between beats. After 65, these two numbers often move in opposite directions, and treating them as a single target creates serious problems. In older adults, it is extremely common to have high systolic pressure with normal or even low diastolic pressure. This condition is called isolated systolic hypertension, and it affects more than 65% of adults over 60. When doctors aggressively treat the high top number, they frequently drive the bottom number too low. And a diastolic pressure below 60 in a person over 65 dramatically increases coronary artery disease risk because the heart only receives its own blood supply during the resting phase between beats. If the diastolic drops too low, the heart muscle begins to starve. A clinical study in Frontiers in Aging found that older adults with diastolic pressure below 60 had a 41% higher risk of myocardial events compared to those in the 65 to 75 range. Yet most treatment plans focus almost entirely on the top number. Ask your doctor about your diastolic pressure. If it is below 60 and you are on blood pressure medication, that conversation is urgent. Now let me tell you about number 5. What time of day your pressure is measured changes everything. Blood pressure follows a daily rhythm called the circadian pattern. In most healthy adults, pressure dips at night during sleep and rises sharply in the morning, typically between 6 and 10 in the morning. This morning surge is the time when most heart attacks and strokes occur. After 65, this pattern can become unpredictable. Studies published in the Journal of Clinical Nutrition and Hypertension Research found that up to 30% of older adults have what is called a non-dipping or reverse dipping pattern, meaning their pressure does not drop at night the way it should. These individuals have dramatically higher rates of kidney damage and cardiovascular events even when their daytime readings look perfectly normal. If you only measure your blood pressure once in the morning at your doctor's office, you have an incomplete picture. Research shows that nighttime blood pressure is a stronger predictor of cardiovascular outcomes than daytime readings. But almost no one measures it. A 24-hour ambulatory blood pressure monitor can catch this pattern, and I strongly recommend asking your doctor for one if you are over 65. This one test could change your entire treatment plan. Here is my pro tip for this section. If you measure at home, take 3 readings, 1 minute apart, while seated, in the morning before any medication and before breakfast. Average the 3. Do this for 7 consecutive days before any doctor appointment. That average tells a far more accurate story than a single reading taken in a white coat environment where anxiety alone can elevate pressure by 20 points. And now, number 4. The white coat effect and what it is silently doing to your treatment. White coat hypertension is not just nervousness. It is a documented physiological response to the clinical environment that elevates blood pressure by an average of 15 to 30 systolic points in many older adults. Studies estimate that up to 30% of patients diagnosed with hypertension at a doctor's office actually have normal pressure at home. This means they are being treated for a condition they may not have, with medications that carry real side effects. The reverse problem also exists. Masked hypertension occurs when a patient's pressure looks normal in the office but is dangerously high throughout the day. Research in the New England Journal of Medicine found that masked hypertension doubles cardiovascular risk compared to sustained high pressure, partly because it goes untreated and partly because the body is under constant stress without anyone noticing. I want to introduce you to someone I treated a few years ago. Dorothy was a 74-year-old retired schoolteacher from Philadelphia. Every time she came to my office, her blood pressure read 160/92. She was on 2 medications, she had side effects, She was dizzy when she stood. She had stopped walking her dog in the evenings because she was afraid of falling. When I asked her to do a week of home monitoring, her average came back at 131/76, perfectly appropriate for her age. She came back to my office and said, "Doctor, I think I am being over-medicated." She was right. We adjusted her treatment. Her dizziness resolved in 3 days. 4 weeks later, she called me to say she was walking 2 miles a day again. "I feel like I got my life back," she told me. I thought that was just what getting older felt like. It was not aging. Her treatment plan was broken, not her body. Moving to number 3. The salt conversation your doctor is probably getting wrong. Sodium restriction is one of the most recommended lifestyle interventions for high blood pressure. And in younger adults with documented sodium sensitivity, it absolutely helps. But after 65, the story is more complicated than most patients are told. A major study published in the Journal of the American Medical Association followed adults over 65 for more than 7 years and found that those with the lowest sodium intake had significantly higher mortality than those in the moderate range. The authors concluded that for older adults, very low sodium diets may actually increase risk of cardiac events, not reduce them, possibly because sodium plays a critical role in maintaining fluid balance, kidney function, and blood volume in aging bodies. The research does not say salt is harmless. It says that aggressive sodium restriction below 1,500 milligrams per day, which is what many doctors still recommend, carries its own risks in older adults. The current evidence supports a target closer to 2,000 to 2,300 milligrams per day for most seniors. That is not a license to eat processed food. Processed food contains hidden sodium in quantities that have nothing to do with whether you salt your eggs in the morning. Here is something most people miss. Potassium may matter more than sodium after 65. Every gram of potassium you consume helps the kidneys flush sodium from the body and relax arterial walls. A study in Nutrients Journal found that older adults with the highest potassium intake had a 27% lower risk of stroke compared to those with the lowest intake, independently of their sodium intake. Avocados, sweet potatoes, white beans, salmon, spinach. These are not just heart-healthy foods. They are blood pressure management tools. And nobody hands you a brochure about potassium at your annual physical. Now let me tell you about number 2. The medications most commonly prescribed for blood pressure after 65 and what you need to know about each one. The 4 main classes of blood pressure medication prescribed to seniors are ACE inhibitors, calcium channel blockers, diuretics, and beta blockers. Each one behaves differently in an older body, and the differences matter enormously. Diuretics, often the first medication prescribed, work by having the kidneys excrete more sodium and water. They are effective at lowering pressure, but in older adults they carry a significant risk of dehydration, electrolyte imbalance, and dangerous drops in blood pressure when standing. Research in the Journal of Applied Physiology found that seniors on diuretics have 3 times the rate of orthostatic hypotension compared to those on calcium channel blockers. Beta blockers slow the heart rate and reduce the force of contractions. They are excellent for patients who have had heart attacks. But in otherwise healthy older adults without documented coronary disease, the evidence for beta blockers as a first-line blood pressure treatment is weak, and the side effects, including fatigue, cold extremities, and cognitive dulling, can significantly reduce quality of life. A 2019 analysis found that older adults on beta blockers reported significantly lower scores on physical function and mental clarity assessments compared to those on calcium channel blockers with equivalent pressure control. Calcium channel blockers, drugs like amlodipine, have a strong evidence base for older adults. They do not cause the orthostatic drops that diuretics do. They are well tolerated, and long-term data supports their use for stroke prevention in seniors. If you are over 65 and currently on a beta blocker or high-dose diuretic for blood pressure, it is worth asking your doctor whether a calcium channel blocker might serve you better. ACE inhibitors and their related class, ARBs, are excellent for older adults who also have kidney disease, diabetes, or heart failure. They protect the kidneys while lowering pressure. The main caution is that they should not be combined with potassium supplements without close monitoring, because they raise potassium levels on their own. Here is the most important thing I can tell you about blood pressure medication after 65. Never stop, start, or adjust your medication without talking to your doctor. These are powerful drugs. The information I am sharing is so that you can have better, smarter conversations, not so that you can make changes on your own. I remember Richard, a 78-year-old retired firefighter from Chicago. He came to me after 2 falls in 1 month. He was not clumsy. He was not weak. He was dizzy every time he stood up, and he had been told that was just his age. When I reviewed his medications, he was on 2 diuretics plus a beta blocker. His standing blood pressure dropped to 89/54 every time he rose from a chair. That is not a blood pressure. That is a fall waiting to happen. We simplified his regimen. 1 medication, a calcium channel blocker, at a dose appropriate for his weight and kidney function. Within 2 weeks, his morning dizziness resolved completely. 3 months later, Richard told me, "Doctor, I have not had a single dizzy spell. My daughter stopped sleeping on my couch. I feel like I have my independence back." This was not a miracle. This was a medication review, and it should happen for every person over 65 at least once a year. Before I share the most important point on this list, I want to make a quick request. If what you have heard so far seems valuable, I am asking for 2 simple things. First, subscribe to this channel. My mission is to give adults over 60 clear, honest health information so they can make the best decisions for themselves and the people they love. Second, share this video with someone you care about, a parent, a sibling, a friend. A simple click could start a conversation that genuinely changes a life. And now we are at number 1, the real target blood pressure range for adults over 65, and why almost no one is told this. This is the single most important piece of information in this entire video, so I want you to stay focused. The target blood pressure for a healthy adult over 65 is not a single number. It is a range, and that range is different from what most doctors still tell their patients. Based on the most current evidence, including the SPRINT trial, the ACCORD trial, the HYVET study, and updated guidance from the European Society of Hypertension, here is what the research says for adults between 65 and 79. The optimal systolic range is 130 to 145 millimeters of mercury. The diastolic should be maintained between 60 and 80. For adults 80 and older, the target systolic range shifts slightly higher, to 135 to 150, because the risk of overcorrection increases with each decade. Let me explain why this range, and not a single number, matters so much. Blood pressure management in older adults is what physicians call a J-shaped curve. The risk goes up at high pressure, but it also goes up at low pressure. The sweet spot, the bottom of the J, is a range, not a point. Treating an 80-year-old to the same systolic target as a 50-year-old ignores the right side of that curve entirely. The HYVET trial specifically studied adults over 80 and found that targeting a systolic around 150 reduced stroke risk by 30% and heart failure risk by 64% compared to no treatment. But when that same population was treated to targets below 130, the benefits disappeared and the harms increased. This is not theoretical. This is clinical evidence, and it is not reaching patients the way it should. Here is what the research also tells us about the diastolic number. Keeping the diastolic between 65 and 75 in older adults is associated with the lowest cardiovascular event rates. Diastolic pressure below 60, especially in patients over 70, is consistently associated with higher rates of coronary events, kidney failure, and cognitive decline. If your blood pressure is being managed aggressively and your diastolic has been pushed below 60, that is a conversation you need to have with your doctor today. Now let me tell you about a patient whose story I want you to remember. Margaret was a 71-year-old retired nurse from Boston. She had spent her entire career watching over patients, but nobody had been watching over her. Her blood pressure had been running at 155/86 for several years. Her doctor kept adjusting her medications to bring it lower. By the time she came to see me, she was on 3 blood pressure drugs. Her pressure was 118/58. She was exhausted. She had stopped cooking. She had stopped going to her book club. Her family thought she was depressed. I did a comprehensive review. Her kidney function had declined by nearly 20% over 18 months. Her diastolic was dangerously low. Her medications were doing more harm than good. We recalibrated. We simplified. We targeted a systolic between 135 and 142 for her age and kidney profile. 6 weeks later, Margaret called my office. She said, "Doctor, I went back to book club last Thursday. I cooked dinner for my grandchildren on Sunday. I feel like myself again for the first time in 2 years." "That is not aging," I told her. "Your body wanted to heal. It just needed the right conditions. And here is my message to you. You are not broken. If you are exhausted, dizzy, foggy, or unsteady, do not accept that as inevitable. Ask about your specific target range. Ask about both numbers, not just the top one. Ask about what happens to your pressure when you stand. Ask about your diastolic. Ask whether your medication list has been reviewed with your age in mind. You have the right to these answers. Now let me give you a clear, practical action plan. Starting tomorrow morning, do this. Before any medication, before breakfast, sit quietly for 5 minutes. Take your blood pressure with a validated cuff. Record both numbers. Stand up slowly. Wait 1 minute. Take it again. Record both numbers. Do this every morning for 7 days. Bring that log to your next appointment. That single sheet of paper contains more useful diagnostic information than most single office visits. Within 3 days of starting this habit, you will begin to notice patterns. You may find that your morning readings are consistently different from your afternoon readings. You may find a significant drop when standing. You may find that your numbers are actually well controlled at home and elevated only in the office. Within 2 weeks, you will have enough data to have a genuinely informed conversation with your doctor. Not just, "My blood pressure was high last time." A real conversation about trends, timing, and targets. Within a month, if there are adjustments to be made, you and your doctor will have a roadmap based on real evidence from your own body. Do not make these critical errors. First, do not stop medication on your own because you read something online, including this video. Second, do not measure blood pressure immediately after coffee, exercise, or stress. Third, do not assume that lower is always safer after 65. It is not. Fourth, do not rely on a single office reading to make long-term treatment decisions. And fifth, do not skip the diastolic number when you record your readings. Both numbers matter. Your body wants to heal. It just needs the right conditions and the right information. So let me bring this together. Here is what we covered today. Number 7, the 120 over 80 target was not designed for your body after 65. Number 6, your systolic and diastolic numbers need to be treated differently. An aggressive treatment of the top number often harms the bottom one. Number 5, time of day and the circadian blood pressure pattern are among the strongest predictors of cardiovascular risk, and almost nobody measures them. Number 4, white coat and masked hypertension affect up to 30% of older adults and lead to serious mismanagement. Number 3, the sodium conversation is outdated and potassium may matter more than salt restriction for many people over 65. Number 2, most blood pressure medications are not equivalent in older adults, and an annual medication review should be non-negotiable. And number 1, the real target for most adults between 65 and 79 is a systolic range of 130 to 145, with a diastolic between 60 and 80, not an aggressive single number designed for someone 30 years younger. Each of these points is actionable. Each one is grounded in current research. And each one is something you can bring to your next appointment and have a real conversation about. My challenge to you is this: commit to 7 days of home monitoring, morning and evening, sitting and standing. Just 7 days. Bring the log to your doctor. Ask them what your specific target range should be given your age, your kidney function, your other conditions. Ask about both numbers. You have every right to this information, and now you have the knowledge to ask for it. I want to hear from you. Which number surprised you most today? Was it the diastolic risk below 60, the J-curve, the potassium data? Leave your answer in the comments. I genuinely read every single one. If this video helped you, smash that like button, subscribe to this channel, and share this with someone you love over 65. You might just change their medical care in a way that changes everything else. Because remember, aging does not take away your body's ability to be managed wisely. It simply asks you to demand wiser management. Take care of yourself.